Hi, Dr. Dave.
Hey, Dr. Alex, how are you?
Doing well today. How are you?
I see you.
Good to see you. Thanks for the invite.
Oh yeah, it's my pleasure. I'm really glad we could do this, and I appreciate you taking the time.
Yes, of course.
Um, well, it looks like we probably can get started here. So, for everyone who is new to the Apollo podcast series, I'm your host, Dr. Dave Rabin. I'm a psychiatrist and neuroscientist and the Chief Innovation Officer and co-founder at Apollo Neuroscience. I'm also the executive director of the Board of Medicine, which is a nonprofit that helps to guide and provide best practices on the use of medicine of all kinds, but particularly unregulated medicines and tools like Apollo that help us to have better healing experiences, easier access to healing experiences, and understand at least what we can do to try to move the needle a little bit for ourselves. So I'm here to, we have a lot of stuff to cover today. I'm really excited to have our guest and friend and colleague, Dr. Alex Milspaw, with us, who has been educating on trauma and pain and sexual well-being since 2007. Alex has a licensed professional counselor, and she has been doing a ton of work at the, I'm sorry, my computer is having problems. She's a certified sex therapist and a licensed professional counselor and a certified master NLP practitioner. And she's the author of a very important and interesting book that came out in 2022 called Hello Down There, which is a guide to healing chronic pelvic and sexual pain, which is a huge problem and an under talked about problem in much of our culture and much of culture around the world. And it's a huge reason for people not having rewarding sexual lives. So this is a very important topic to cover. And also something that Dr. Milspaw has had experience with Apollo in helping people in this area of health and well-being, which is very, very interesting. And we'll talk a little bit about that later. And Dr. Milspaw also specializes in hypnosis, PTSD, and pelvic pain. And her focus and passion is bridging the gap between the medical and psychological worlds. So thank you so much for joining me, Dr. Alex. And just to select, do you prefer me to call you for today, Dr. Milspaw, Alex, Dr. Alex?
Oh, Dr. Alex sounds fun. Let's stick with that. It reminds me of good old Dr. Ruth. She got it started for us.
Yeah, I like that too. Okay. So before we kick it off to you, I just wanted to introduce everybody to the webinar and format, which is that, we're doing this live. We want to answer your questions. So please use the Q&A box to send them over. Don't send them in the chat box because that'll make it harder for us to keep track of them and make sure they get answered. So if you want your questions answered, please send them in the Q&A box and we'll do our best to answer them while we're here today. And our team is doing the best to answer questions about everything else that they can on the chat while we're in the Q&A while we're here. So if you have anything that is product related, our team will answer that for you if it's related to Apollo, or you can reach out to our customer service who's happy to help. We also have, it's also important to note that we're going to be talking about a lot of health related stuff and medical related stuff. And we're talking about things that can apply to lots of people for general health considerations, but this is not by any means personal medical advice. While we're healthcare practitioners, we don't know you personally, so we're not your healthcare practitioner. And if you have questions about whether any of the things we're talking about are right for you, please go talk to your healthcare provider and ask. And I'm hopeful that they will be able to give you guidance in that. So with that, and also, of course, in that vein, we can't answer any personal medical questions about you today here, but we will hopefully provide you with lots of answers, lots of other questions that help us understand how to live a good life and how to have healthy relationships and a healthy love life and sexual life, because sexual health is actually an part of health that's absolutely critical to our well-being. It's fundamental for reproduction, and it's very, very important to our general quality of life. So, Dr. Alex, thank you so much for joining us.
Yes, and I will warn you, I love talking about this topic, and I could talk all day about it. So I will try my best to keep the answers short and sweet and to the point, and reel me in if you need to, if I get lost on too many tangents.
Oh yeah, no worries. You do a good job of that naturally. So maybe could you just start out by giving us a brief highlight of about you and how you got into the space?
Yes. So I think my passion for how all of this is connected between trauma, pain, stress, sexual health, pelvic wellness, sexual wellness, really started with my experience with the Vagina Monologues back in college, and producing that show and running cast meetings and hearing people's stories, but also seeing the experience of how being able to just talk about it in the space of those cast meetings created such a transformation for the folks that were involved in those productions. And it was really those experiences that said, you know what, this is needed, and I love it, and I want it, and I want to know more about it. I want to be able to understand it and be able to talk more eloquently about it. And then it took off from there, and I met Dr. Robert Eckenberg when I was in graduate school getting my master's in counseling psychology, and he was a specialist in pelvic and sexual pain, and his presentation scientifically put it all together for me. And from there, I joined the International Pelvic Pain Society, and I found my people, physicians and healthcare providers from all different directions, really coming together to talk about these issues and wanting to learn from each other, rather than it being a power struggle and ego battle of who knows best. It was more, how can we learn from each other? How can we work together? And it's been happily ever after ever since. And I'm honored to be on their executive board right now. And you spoke about the limited training that's currently in medical schools, as well as psychology and counseling grad schools. So again, that's my passion, is to bridge that gap, because the curriculum's really missing in both of those places. And I'm working with phenomenal physician colleagues right now through the IPPS to not only create that curriculum, but to help demonstrate the need for that curriculum. So this is one conversation of many that I really want to have to help spread that information. And I will also add, as far as the questions, I love questions. And if there's a way, I meant to ask your staff this before we jumped on, but if there's a way to even get a list of the questions that are submitted, I'm happy to answer those 1 week at a time through my Instagram live sessions. So, I'm here to help, and I'm here to pass along the information. So again, thank you for inviting me to be here.
Yeah, absolutely. Thanks, Dr. Alex. And we're happy to do that. We can get you lots of questions after from this. So I'm sure there will be many. But first off, thinking about what it is we're talking about, I think, how common is pelvic pain, and how often do disorders of the variety we're talking about interfere with sexual health and well-being?
Well, it's more than I think we know right now, and the numbers are already staggering. So for those that identify as female, or those that research identifies as female, it looks at 1 in 5, around 20%, if not around 20 to 30%. So it can even be 1 in 4 sometimes. And for those that identify as males, or those that research identifies as male bodies, we're looking at more like 1 in 7. But again, we think that's more. Because of the hesitancy to talk about this with physicians, let alone when patients do bring this up, then they might be shut down, both by their physician as well as their therapist. And it never ceases to amaze me. And yet every time I hear it, I get frustrated and boggled when I hear about a therapist that refuses to talk about sex, and when I hear about a sex therapist that refuses to talk about pain. And I'm like, what's going on? And, the reason I think it's more is certainly I'm biased because all I see are the people that haven't gotten better yet. But I remember one of the first presentations I did for a female athletics group at a university, and I just asked for a raise of hands, for example, of who has pain with either sex or a gynecological exam or a tampon, and everybody raised their hand. And most recently, I did a presentation with there was about 200 female CEOs, and I'm not going to label the organization that was there, but I was supposed to be their keynote speaker talking about resilience and how stress affects the body. And they had removed every slide that had the word pelvic or sex or sexual in it. And they told me they didn't want me to talk about it. And I'm like, okay. And it turns out they were afraid of losing their funding if someone else had seen the photos or the images. But if you know me, I did it anyways. Because I said, you really need to know this information and how the series of events that can really create what we call chronic pelvic pain. And I just I show a slide that has all the various symptoms, including GI symptoms and bladder symptoms and this experience and that experience. And I asked for a show of hands. And once again, 90% of the room of 200 plus women raised their hands. And so I know it's out there, but again, they don't want to talk about it. They're afraid of talking about it. And so here we are.
Here we are. Doing the thing we do, talk about things people are afraid to talk about, right?
Right. And I have to remember that too. Sometimes I'll just jump right in with a client and they're like, I'll use the word, I'll just use certain words and I forget that people don't talk about that. Right. Including how often do you pee and how often do you poop and what does your poop look like? And they're like, hold on, we're just getting started here.
Yeah.
Yeah,
absolutely. I think, one of the things that I hear you talking is this sequence of events that results in chronic pelvic pain or dysfunction. And, trauma is, of course, something that seems to be related to this emotional, mental, physical. It seems like they're all kind of tied in there somehow, that they can impact our perception of these experiences. Can you talk a little bit about the relationship between pelvic pain and trauma?
Yes, absolutely. So the experience of trauma and stress and pain are all processed the same way in the brain. The same neural nets light up. And when it happens a lot, right, as far as it creates a habit, and if we haven't learned how to release that energy that's created, that tension that's created, talking about what's going on, then it builds up, right? The body bears the burden, as Robert Scar's book talks about, or Bessel van der Kolk, his book, The Body Keeps the Score, right? There's enough research out there that looks at if we aren't able to release it, the body absorbs it and manifests it. And what's fascinating is that the body seems to hold stress in areas of past trauma and or physical injury. So for example, I remember growing up and my grandmother would say, I know it's going to rain because my knee hurts, or your father's upsetting me again because I have a headache, right? And, we see these patterns. But the problem is not only that we're not learning from early childhood, how to manage modulate our nervous systems, but we're often taught not to talk about it and not to even pay attention to it. And if it's not safe to pay attention to it, then we train ourselves to just live from the neck up, and we really disconnect from physical sensations, which is also why things can start to build up physically, because we start to not realize that we're hungry, or we start to not realize that we have to use the bathroom, and something as simple as that. Or again, we can be trained in that way. If I went to a school where we weren't allowed to use the bathroom until certain times, or there's anxiety of if you're in the bathroom for too long, and then you're shamed and then you're punished for it. So then you have kids experiencing toileting anxiety and pressures starting from kindergarten. And again, we're not realizing how that builds up in the nervous system system, causing not only GI issues, but again, chronic nervous system stress and complications. And the pelvis really bears the burden of all injury because the pelvis is the center of us physically, as far as anatomically. We know that injuries in our extremities can be seen being compensated within the hips and within the pelvis. And so again, people don't really think about that.
Obviously, any injury to the lower body is compensated in the pelvis as well.
Yes, right. Absolutely. That's a definite. But people won't think about, people don't think about that, let alone the imbalance of right-footed and left-footed, right-handed, left-handed. But I think what I hear the most is when I ask someone, have you experienced high stress or trauma? They'll oftentimes say, no, I haven't experienced trauma. And then I have to define what trauma means, right? And I love Gabor Mate's definition of trauma isn't what happens, it's how your body reacts to what happens.
Exactly.
And then we start having a more deeper conversation of, oh, okay, now I see what's going on here. And so when things build up in the nervous system, it creates habits, and chronic pain truly is a neural circuitry habit and pattern that occurs within the spinal cord and within the brain, let alone muscle habit, right? We can develop a habit of good posture, or we can develop a habit of poor posture, right? Everything is about habit. And so that's really what I start with when people are saying, looking to me for hope and healing. They're like, well, I've had it for this long, so that must mean I'm never going to get better. And it's like, all habits can be changed. We just need to know what to do and how to get there. And I'm going to talk about some of that today.
So to put that into context, is it possible, just for thinking about the trauma story and what you're describing, is effectively the way that we learn, right? We're automating our bodies and our brains are like sponges. They're automating machines that intake information our whole lives, and whatever the context, we're just creating patterns and loops around those things that seem to work for us at the given time, but may not work for us later. And
absolutely.
And then when you think about that in the context of like something that could make us feel strange about sexuality and make sexuality odd, for instance, like, it reminds me of what we see in a lot of young kids who are shamed for masturbating. And then
right.
I could imagine that, a young woman who is achieving like pleasure subjectively from engaging that experience, who then is shamed by her parents or shamed by someone in school or a teacher or what have you, would then maybe find, over time, if there's no talking about that and understanding that, it's not her fault, it's not a bad thing, that she could be potentially, struggle to achieve climax in future situations in sexual engagements, right? That's kind of is that a pattern that you see in your clients as well?
Absolutely. And shame is literally one of the most toxic emotions that we can experience. Because cortisol spikes the most when we are in a place of shame, and shaming can start even before that, right? I mean, someone's changing your diaper and you're just curious, not even thinking about it, and the parent or caretaker slaps your hand away.
Right.
There's a confusion there. And what we do know about children's brains is they're most of the time in delta or theta waves. And so that is just downloading. No, not really a filter. And so then we spend the rest of our lives weeding the garden of our minds of plants that we didn't plant there. And I love Resmaa Menakem's book, My Grandmother's Hands, because he really touches on the importance of thinking about ancestral and generational trauma, let alone what we know about with prenatal predisposition, right? Prenatal training and neonatal training of the nervous system, which can predispose how the nervous system then also, again, reacts to stress and reacts to sensory stimulation.
And so if we don't understand that might be happening underneath the surface, that our nervous system might be in a stressed out state, for instance, or in a state that's traumatized because it's reacted to a stress or a challenge in a way that is promoting the fight or flight system, it's promoting alarm, then naturally that would lead one to believe, if you follow the scientific, like the neuroscience, right, that when the body's in that alarmed fight or flight state because it perceives that something's wrong, that even if it's not actually wrong, the perception of that something being wrong would actually prevent us from diverting any resources to the reproductive system at all, right? Because our bodies have this like tight evolutionary journey from way back, millions of years ago, where, we evolved to not allow our reproductive system to turn on when we're in a threatening situation, like running from a lion or a bear or something like that, right? That would be very bad. So
yes, not the time.
right.
Right, exactly. Although what is interesting in some species, and I'm not sure how many species, but we see this in humans and kangaroos at least, is that there can be a difference between how males and females react evolutionary wise too, right? If there's, for example, kangaroos, if there's stress in the environment, the males try to have as much sex and spread their seed as much as possible because that's what's necessary for survival. But the females say, no, 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 no. Now's not the time for me to get pregnant because it's a drought, right? And so there's that disconnect and that sense of how we can react differently to stress. But as you know, to go back to the sense of how we're learning shame around sex and intimacy as a child and as a youth and as teenagers, that's an important conversation, particularly around any childhood sexual trauma, or things like that, or even sexual trauma at any age, because our bodies can respond to stimulation when we don't want it to. And that can be extremely confusing for anybody when that happens. And so when someone finds themselves needing to actually be upregulated in order to experience arousal or orgasm, we have to think about, well, how was, again, training and habits, how was your nervous system trained? And that's not your fault that it was trained that way, but anything that's learned can be unlearned. So let's look at how we can unlearn that, and then you choose how you want to train your system to respond. And the same thing goes with pain, and the same thing goes with the stress response. Because again, what's familiar versus unfamiliar, the brain's job is to say anything that's unfamiliar is deemed unsafe until proven otherwise. And so sometimes if someone's lived in a stressful fight or flight mode for their whole life, and now they're wanting to relax, the process of relaxing, if done too quickly, can create in and of itself an anxiety or a panic attack. And so what I love about the Apollo Neuro device is it's a gradual stepping down process of retraining the nervous system rather than such a huge drop that sometimes some of the other interventions can do. And then that tends to make the pendulum swing back and forth. So I just wanted to mention some of those points before I forgot.
Yeah, no, that makes a lot of sense. And I see it as being this as being foundational to the whole conversation we're having today, right? Because everything, if we can understand how to be aware and kind of get where we're at right now, and what is our body doing? How are we reacting to stress? How are we how do we think about ourselves? How do we function sexually in relationships, et cetera? We get in a general assessment of how we are right now, and then we can think about and become aware of how we're starting to respond to situations in ways that actually serve us and that help make us happier and more joyful and fulfilled. And then also when we're not, and when we're not, it's not our fault. Again, as you said, it's kind of like learned behavior, right? We've been taught this over and over and over again, this way of living and being and thinking, and that has its impact on meaning, especially in relationships and vulnerable situations like
completely
sex and lovemaking and connection and all of it, intimacy. It's all very vulnerable for us as human beings because we're exposed, very literally.
Yes, and I think someone understanding their life's timeline and realizing they are where they are and who they are because of what they've been, because of where they've been and what they've experienced, but that doesn't dictate where they want to go and where they can go and what's possible. So I often start with kind of just, again, a timeline of, let's look at what your nervous system has experienced. Let's look at the takeaways that were useful for survival at that time, but again, are no longer helping,
Right.
no longer helpful right
Right.
now. We need to update the program. If my phone updates every 2 days, think about how often we need to update the brain. And that sense of expectation and learning, right? What did you learn about sex? Who talked to you about sex? What were you expected to know? And what are you expected to like? What are you expected to enjoy? And if we're learning it from easy access of porn or various movies or Hollywood or TV or TikTok or whatever it might be, you and your partner could, or even different parts of yourself could be on very different pages on what, even just defining what safety means, let alone defining what good intimacy or good sex means or what pleasure means. So we have to first, I say we have to first define safety, because some people might not even know what that means because they've never felt it,
Can
or
we?
they can't
You want to
perceive
start?
that they have
You
felt
want to you want to start there and jump into intimacy?
it. Ooh, yes. Well, I think safety has a lot of different definitions for people, but certainly in the basis of the nervous system, I call it around, we want to be around alpha, beta, alpha brain waves, delta brain waves. That's ideal. But we also don't want to be so relaxed that we're falling asleep when it comes to intimacy, right? It's that delicate balance of relaxation and excitation, right? We don't want to be in fight or flight mode, right? We want to think of it as a spectrum. And that's what I love about Tantra, really, is it guides us to kind of play with that volume level of excitation, and then we're calming and grounding, and then we're getting excited, and then we're calming and grounding. And we're creating more of an ebb and a flow with a partner, and having the experience in and of itself be what creates safety and what helps us discover not only what feels good for our partner, but more importantly, what feels good for us. I mean, healing is all about self-discovery, and self-discovery leads to healing automatically. And so, intimacy was defined back in grad school, which I loved, which was in to me see. And so intimacy is being seen. And we can't let anybody see us if we don't see us. And so, again, talking about with each partner, if there's a partner or multiple partners, or again, even just with one person, how do you allow yourself to be seen by yourself, let alone other people? And what's that like? Let's talk about that vulnerability. Let's talk about the courage. Let's talk about Brene Brown's magnificent research that she's really gotten out there about what vulnerability means and all that. But let's talk about how are we intimate with ourselves? And that can start with just playfulness. Do we allow ourselves to play? Do we allow ourselves to laugh? Knowing that play is utilized by most mammals, at least, and definitely humans, as a way to learn about our bodies and to explore and discover how our bodies move and function, let alone building trust. Can I trust that if you're biting me a little too hard, as my one dog says, then I'm going to bite you back, right? So, if dogs don't have puppies to play with, they don't learn where that boundary is. And so humans need to play like that as well, outside the bedroom first.
Yes.
Foreplay is 99% outside of the bedroom. And the benefits of all of that gets played out inside the bedroom. So I'm big proponent on play, and play leads to intimacy. Eye gazing can lead to intimacy. Eye contact in general. We know that 18 seconds of eye contact shifts the brain from perceiving someone as a stranger to perceiving them as someone that's familiar. And that in and of itself can create safety. But ask someone to look in the mirror at themselves for 18 seconds and it's really hard for some people. So again, I have people start first with themselves, and then, so kind of both of them practicing these techniques and getting comfortable with it, ultimately creating a sense of control and power within themselves to self-regulate and to feel comfortable with it, to be seen by themselves. And then we bring it back to the relationship, assuming it's a dyad. But
Yeah. I love the way you describe that. I think that that's I've never heard it really broken down that way before. And it's just it's so meaningful because the word intimacy, as you described it and broke it down, represents exactly what we're trying to teach people in therapy, right? It's
Yes.
how to see yourself as you are, and how to be present with yourself, and therefore learn to trust yourself. And as we learn to trust ourselves, then our ability to know when and how to trust other people in different situations gets amplified very significantly, which is so helpful.
Yes. And I'll take a moment to use more of the extreme cases, just because I think it's not necessarily that. I think it's more common than it is known. But the concept of when someone is more dissociated than they are present. And I had a mentor say, "Don't take down a fence until you know why it was built." Therefore, don't ask someone to be in their body when you know that they dissociate, when they've talked to you about they don't feel comfortable in their body. And so I say, first we need to talk about that, right? And so again, like, let's practice observing from the outside in. Again, start with where they feel safe. But then I'll use the metaphor. Metaphors are big. Metaphors are kind of a backdoor to the subconscious that I like to use a lot. And they'll say, "Well, I don't like being in my body." I'm like, "Okay, but every jigsaw puzzle comes with lots of pieces. And we've got a lot of pieces going on here. So is there one piece of the jigsaw puzzle of your body that does feel safe to think about, to tune into, and usually there can be at least one piece, like the tip of the nose or an earlobe or something like that." And I'll say, "Let's start there and build piece by piece as it feels safe and comfortable for them. And as they're wanting, we want to make sure that they're guiding their goals, not I'm guiding their goals." But again, we start piece by piece to really start putting that puzzle together. And I was going to say something else and I lost my train of thought. But we don't want to rush into it, and we want to help them learn that it's possible to tune into their bodies. Oh, so that being the concept of interoception that Dr. Daniel Siegel did a great job of talking about his research in his books, Aware and Mindsight, in terms of the practice of being aware and present of physical sensations in the body, while being that passive observer, or not necessarily passive, but while being that calm observer. And again,
Right.
Apollo device
not
has worked
judging,
wonders.
just listening, not judging.
Correct.
That
Yes.
kind of observing, right?
I call it compassionate curiosity.
Right. That's a great one. Yeah.
And then we define the difference between empathy and compassion. Thank you, Tanya Singer, for that work in Germany. But yes, so can we be compassionately curious of what's happening in the body? And again, we start with something that's simple. Maybe my eyeballs, maybe my mouth, maybe my hair. Can I be curious about all these different sensations I feel as my earrings are moving around? So we start with the puzzle pieces that feel safe, and we build towards that. And the cases I've had that have been able to access the Apollo device, that movement, and even some of the worst trauma that I've heard of, it's just moved so much faster, and it's so relieving to people. They're like, "Oh God, I thought I was going to be doing this therapy for 20 years. I'm like, no. It doesn't have to take that long to retrain the brain.
That's so amazing.
Yeah, it's
Okay.
really awesome.
Well, that actually brings up an interesting question we had from a member of the audience, which was about transitions. And, the idea that, what you're talking about is transitioning from helping somebody transition, like we do in our practices, from I've done everything I can and I don't think I can ever get better and I'm really struggling, to I'm actually having relief to an extent where I now have hope that I can get better again. Right. I have a renewed faith in the healing process itself.
Yes.
And that's really beautiful. And I think that's what we always strive to empower people with in therapy. And, is a big focus behind, what we do with Apollo and why it works the way it does. And I, to the point that you were making about, actually, this question was on the transition front. Before I get to the other thing I was going to ask you, is that, you know, many people like this person have asked, you know, I have trouble transitioning into a state where I'm ready for intimacy, right? I do have times where I know I am comfortable being intimate, but I have trouble transitioning into those states with my partner, or
Mhm.
whenever that I actually am able to have those experiences. And so that's frustrating and really inconvenient timing wise, right?
Yes.
And I think a lot of it seems to be associated, from what I see and what I hear, a lot of it seems to be associated with just people being so stressed out, overwhelmed, overworked from the day, having too many responsibilities, too much on our minds. It's hard to get into the mood. But are there any you know, two questions I have for you? I know you've seen Apollo in use with a lot of people like this. Have you seen any particular ways that Apollo's helped with those transitions for people into intimate states? And do you have any other suggestions that for what people can do to help make that transition more smooth?
Yes, yes. Let me start with, again, another metaphor that I use a lot. We practice Lamaze months before delivery. We don't wait until we're in labor before we start practicing breathing exercises. So if we are not practicing some of these self-regulatory, even getting in the mood exercises, let alone, do we know what gets us in the mood? Do we know what gets me in the mood? I don't know. Right. We have to answer some of those questions first. And are we practicing that, not necessarily only with masturbation, but again, down regulation exercises? Are we practicing that outside of when we are wanting it to absolutely work? Because again, if it's practiced and rehearsed, not only is the brain going to get there a lot faster, but I have confidence in that technique, or I have confidence in that process, in that protocol. We see every athlete have their own little routine or thing that they do, right? Maybe they bounce the ball 3 times, or, you know, obviously I don't watch that many sports, but, you know, they have their little dance, or they have their little prayer, or they have their thing that they gets them in the zone.
Mhm.
And intimacy is one of those things where we need, how do we get in the zone? What helps us tune into what we want to tune into? And the way Apollo has helped with that is twofold. One, again, I have them practice outside of the sense of time pressure or partner pressure or personal pressure, which is the majority of the time. I need to be turned on now. My body needs to respond right now in this way. And if it doesn't respond, that means it must not be working. Or if his or her body or their body isn't responding because I can't see it, right? The erection seems to be, you know, what people always look for, rather, you know, but it's like what's happening physically also doesn't necessarily dictate what's happening in the mind. Someone can be aroused and in the mood, but their body isn't responding for a variety of different reasons.
Right.
But you know, using Apollo to get into that space again for a few times when there's more time to play with it, so they can also feel confidence in that device and know what it can do for them and know what setting works best for them.
Right.
You
And
know, all of that.
yeah, and even whether it's Apollo or not, I was just going to add, it's interesting what you're saying is that it's really important. It's not just something that we should consider doing. It's really, really important for us to know very clearly what it feels like to get ourselves into a certain mode or state of being
Yes.
before we have to go into the game time moment.
Yes, absolutely.
Yeah.
Exactly. Right. I might not be in the mood to exercise, but I know as soon as I put my yoga mat out and get into that position and just breathe for 3 minutes or do my ohms or whatever it is, now I'm ready for my yoga routine. And if I do a few sun salutations and I'm like, yeah, I really don't feel it. Okay. We want permission to change our minds too. Right. Someone might say, well, once we do this, then we've got to do the whole thing. And then I go back to the food metaphor. And I think I talked about this during our last conversation. I'm like, if you decide to go out to eat, even if you're not hungry, you're still going to go. And your partner's not going to force feed you. And you're not going to have to eat the 5-course meal just because they're eating a 5-course meal.
Right.
Right. And that usually, again, the metaphor works because they're like, yeah, I wouldn't force feed her a steak. I'm like, so then why are we making a vegetarian eat meat when that's not what they want?
Only we
Right.
can force feed ourselves.
Right. Right, exactly. Um, so it's that sense of permission they give themselves to be seen and be vulnerable. It's that permission they give themselves and to think about what they want of, do they want to choose what they do they want to be the guider, or do they want to be guided? Do they want it to be a mutual conversation? Do they want it at the same? Do we want to experience pleasure at the same time, or do we want to take turns, like sensate, focus, touch, and that sort of thing? So it's let you know, what are you in the mood for? I'm in the mood for Thai. I'm in the mood for Italian. Okay, let's see, how are we going to work that out, right? Those types of conversations need to be had, but we can't have the conversation if we haven't first had it with ourselves.
Right. And thus going back to the core again of why we started with shame, because if we can
Yes.
step away from shame, or maybe just ask ourselves the question, to ourselves the respect and the honor of asking ourselves the question, is it possible that what I was taught about sexuality or about my sexuality is not the full story? Right. Then it opens up. If we can say, yes, it's possible, that doesn't require us to commit to anything significant. It's just allowing, well, anything that defies what we already know or diminishes what we know. It just allows us to commit to trying to know more, right? Trying to
Yes.
know more of the full story and discover more of the story. And I think that this, it allows us to step away from the shame and guilt of thinking about these things or engaging in these things, because they're just part of being human, and they're
Yes.
a critical part of our happiness and our well-being. And
And
I was
yes.
wondering, yeah, if you could talk a little bit about the health benefits of intimacy. I think intimacy and touch are some of the most, from my studies, some of the most important, most impactful things that help us feel better. Could you talk a little bit about the health benefits of that and how this impacts people's lives to have more of this?
Yes, and I'm going to link that with, continuing on the question of transitions, right? So transition of the day, right? Putting my therapist hat on, and then I need to put my mom hat on, and then all of a sudden I need to be sexy wife hat, that's a lot sometimes. But again, if I have a rhythm of how I know what I do to be able to shift from my work mode to my mom mode, and I know what to do when I need to shift from one to the other, and I've practiced it and all of that. But what we do know is, particularly when there's stress or pain or a history of trauma involved, we need to calm down cortisol. And as you said, physical touch is one of the main things that increases oxytocin, which decreases cortisol. And so whether we're talking about transition within our day or transition of life transitions, right? Transition from being a student to now a full-time worker, or a full-time employee to now stay-at-home parent, or a transition from high fertility to low fertility, or menopause, or so many different life transitions affect us, certainly on a biological level. But we know that if the nervous system is able to remain in that regulated state that Apollo Neuro really helps with, the ripple effects are less intense. We know that if someone has a history of self-regulation and they look forward to menopause, for example, and they're, this transition of life of empty nest, and they haven't downloaded all these fears and worries of, I've heard it was horrible, or, and same thing goes with pregnancy and delivery. Same thing goes with periods, expectations. Same thing goes with all these things. The body, yes, it still goes through a change, but it's not like this. It's more like this. Right. And then you're looking at transitions that happen even within one lovemaking session. I'm in the mood and then I get distracted and I'm thinking about something else. Or everything's hot and heavy, and then the child knocks on the door. Right. It's hard. It can be challenging to shift back and forth. But again, it's almost trusting, a little bit of trusting the process, allowing the process, which will help you trust the process, and not just taking the sense of, oh, okay, guess it's done, versus hold on, I gotta do my routine of getting back in the moment again, right? And touch really helps with that. So touching, I say, starts with eyes, because we feel touched when someone looks at us, in a loving, kind, well, in any way, but in a safe way. We're looking at loving, kind eyes. And then again, just people can start that sensei focused touch of maybe starting with extremities, like a hand massage or a foot massage, knowing that reflexology and the study there really relaxes the whole body. That science is fascinating. But again, there's ways that you can utilize touch similar to what the Apollo does, is it tunes into that sensation of touch and just calms the system. And it just makes that transition through all the different examples just so much more smoother, and enjoyable and accessible.
Yeah, that's really interesting. And there's another metaphor you brought up there that I really liked that I was trying to go back to, but it might have escaped me. Yeah, I just really love the way that you described that with transitions. And I think there's another transition that we can't ignore that you touched on a little bit, which is the transition into menopause, right? And there's a ton of changes that occur in menopause. Would you be able to speak a little bit to postmenopausal vaginal pain or postmenopausal kind of just numbness, not really being able to feel much at all, and maybe a little bit about why might somebody be feeling that, and is there anything that people can do?
Sure. Yes. And so I will remind folks that I don't have medical training, although I've been to more medical conferences than psychology conferences at this point, I think. But I'm not a gynecologist. I don't have specific training on hormones and things like that. And there is mixed research on whether hormone replacement therapy is useful or not. And again, I think it's such a personalized approach that it requires. And I believe in the power of the mind to guide the body and how we want it to do, but we have to be patient, and we have to get the knowledge and the information we need to help us be patient, to get back to that place of trusting the process.
You didn't get here
So,
overnight.
pardon?
You didn't get here overnight, so it's going
That's
to take
right.
more than a couple days to get us where we want to go, but we'll get there eventually.
Yes. And I will say that, things like either vaginal dryness or lack of erection or lack of desire, and I'm going back and forth between obviously, sexes, but it can be influenced by a lot. I think it's easy to blame menopause, but those things can change for so many other reasons too, as far as hormone levels and vaginal lubrication and blood flow and that sense of vitality, that sense of energy, or the sense of chi that we are now understanding more and more because we're figuring out how to measure it scientifically, as they say. But I want to, before I even start talking hormones with folks, I want to talk again, stress level, because things are going to dry up if I'm in fight or flight mode, let alone if I'm relaxed. Oh, it's, all is well. Things can dry up based on systemic inflammation, which is all source, it all starts in the gut. The gut cell layer is the protective layer between everything that goes through the intestines, and the mucosal layer, I've learned, is only one cell layer thick. So it doesn't take that much agitation within the GI system to affect the mucosal layer. And now you're looking at systemic inflammation in all the mucosal layers. And guess what? The vagina is lined in it, let alone the urethra, let alone the lower colon. And I work with a lot of folks that have had a lot of abdominal surgeries, either sports hernias or bowel resections from diverticulitis or C. diff or Crohn's or all these different things. And again, the adhesions and the scar tissue from endometriosis as well, right? All of that will decrease blood flow without pelvic floor PT. And there's things we can do about that. And I could go on and on about that, but there's a lot of things that we can do before we get into, do I need hormones?
Right.
Because
we should do.
And we should do. Yes.
These are like the mind techniques and the body techniques that are natural, that can help actually make a huge difference in the process, whether
Yes.
you're pre or postmenopausal or man or woman, that we can all do to help really get a good solid start on the process. And people like Dr. Alex and I can help. Dr. Alex knows a heck of a lot more than this than I do. So, but these are all techniques that we can start to do on our own, which is really cool. Whereas, and they don't have side effects, right? This is
right.
not side effects. This is stuff that is really self-improvement tool sets that we just weren't taught, but are highly evidence-based and really do the trick when we actually practice them.
Yes, and it can heal the whole thing, not just
Right.
the
All the mucosal linings.
right. One of the most fascinating experiments I was part of was with Dr. Deborah Wickman, who is in Arizona. I want to say, I'm blanking on where she works out of, but she developed what's called the integrative pelvic exam protocol, which includes the person holding the iPad that's connected to the camera, that then she shows these women, particularly postmenopausal or even post, first or third or fifth baby, to show them, look, you're not broken. Look, you're still pink and voluptuous. Look, you still got lots of fluids going on, right? Because again, if the mind has this image of it's a dirty, dusty attic that's all dried out and no one's going to love me, the brain can create this image that just isn't accurate. So it's just amazing what we've seen with some of what can happen just by allowing ourselves to look at ourselves. But then we're back to the shame conversation and needing to shift that. But yes, we want to look at full health overall. And again, the nervous system and the brain is at the top of the algorithm. When we calm the amygdala, when we balance the nervous system and the brain, everything is downstream from that. And the body wants to return to balance. It doesn't matter how old you are or how young you are or what you've been through. We have an amazing intelligence system that knows how to heal. We just have to get the stuff out of the way that's blocking us.
Yeah, absolutely. And I really want to, and I think your book does a really great job of demystifying these kinds of things we're talking about here and really taking the shame out of the picture, because it allows people an opportunity to read. And the book is called Hello Down There by Dr. Alex Milspaw. So definitely check it out. Because it goes into a lot more detail about the stuff that we're talking about here. And I think it really destigmatizes this subject matter and helps people to understand, whether you're a practitioner looking to try to figure out how to have these conversations with your clients or your patients, or if you're a parent or a child looking to, or a teenager looking to figure out about yourself or how to talk to your kids. This is a very, very approachable way to start to understand in a just completely evidence-based, factual, but very approachable scientific way, this is what the body's about. This is what our bodies are capable of. This is how we can have a nourishing, nurturing relationship with our bodies, with our health. And I was really honored that you mentioned the Apollo in there and how to use it for that purpose and improving intimacy and sexual health. So I really appreciate that.
I had to. And thank you for mentioning my book and saying those kind words.
It's just
yes,
true. There aren't a lot of books like this out there.
That is true. That is true. I was thought of something, but
Well, I was gonna maybe this on a segue to that, because I know we have to wrap up. Would you, how did Apollo fit into the book for those who haven't read it? How does it fit into the way that you're working with clients, or I think more interestingly for people who are in the community, a way that they can start to work with it to help them on their own start on this journey?
Yes. So multifactorial. So in terms of, because I believe and the way I understand the science is the nervous system is the first and foremost that we need to shift, and everything downstream will return to balance from there. Some people have had a bad taste in their mouth about some of the basic calming techniques that are taught. Sometimes it's because of the way it's taught, sometimes because it's too much too fast. You need to meditate 2 hours a day and you'll be okay. And if you don't do that, you're not going to get better, right? The negative hypnosis that's out there.
Right.
Or again, the sense of, I work with a lot of trauma and dissociation and or chronic pain where they don't want to do breathing techniques because that's what triggers their anxiety. Or, again, sometimes the typical things that are taught in cognitive behavioral therapy seem to be either inaccessible or in themselves a trauma trigger for a lot of the people I work with. And so between the Apollo Neuro and bilateral stimulation music and emotional freedom techniques, the meridian tapping, those are, and again, if they have a sensitivity, particularly if they're on the spectrum, they have a sensitivity to some of the meridian tapping or some of the sound. The Apollo is the perfect first step that can lead them to this sensation that they've never experienced before. I was working with someone on the spectrum who's in his 50s, and he called me, and he, after the first session, after he received, first session, told him about Apollo, he called me up and he said, "Dr. Alex, I have never felt this way before."
Wow.
And it was just like, he said, this whole veil has been lifted for him. And we've seen this domino effect of just improvement of so many things. This Achilles injury that he's had for 3 years that wouldn't heal, now all of a sudden he's running 2 months later. I mean, it's just
Wow.
amazing,
What
right?
a
So
case study.
that's what I'm working on, the case study. I'm working on it. So yeah, I mean, I've just seen it be life changing for people that have tried it all and nothing worked for them. Or again, it was too fast or too intense, or they, negative hypnosis around it. And so again, the that's why I had to include Apollo, because it's shifting. And again, for children too, right? It's shifting, it's deepening sleep. And if we can get them to sleep, everything that heals everything, helps everything.
Yeah. Everything gets
It's
better.
helping menstrual cycle pain because of the way it calms down the GI system, which then calms down the systemic inflammation and autoimmune issues. I mean, all the different things underneath the umbrella of chronic pelvic pain and sexual pain and associated dysfunctions. All of that is based on, again, the initial health of the nervous system. And so we can, whether we're talking about outside the bedroom, just normal functioning and how they feel with their bodies, or we're talking about in the bedroom and wanting to explore their new bodies, new body after pregnancy, or new body after menopause, or new body after injury. I've had a new experience after some brain surgeries and had to really rewrite the narrative of how to enjoy different things. Learned a lot about cerebral spinal fluid and what happens with arousal and orgasm. So there's a lot of different things that, again, there's so much shame and stigma around sex in general, let alone sex and disability or sex and pain. And the Apollo just really is the beautiful thing that gives it all a hug. So I love that you actually named it a wearable hug. It just really helps someone feel that they're able to access the techniques that they were taught, and then they're blamed if those techniques don't work. Well, you must not be doing it right, or you must not be, practicing, or just anyways, that's a whole other topic of conversation.
No, it's very real though. And,
Yeah.
I'm so glad really warms my heart to hear that it's made such a difference to you and your practice. I feel the same way, but that really made my month, because I don't hear from clinicians. I don't talk to the clinicians about this that often, and hearing it from you, just seeing the impact it's had on your clients, the impact it's had with helping people recover who have been had such challenges with
Yes.
on the spectrum, off the spectrum. I mean, it's just it's incredible to hear. This is what we live for as practitioners, and so I really appreciate you sharing that.
Yes, and I love it, and I promise I'm going to do my best to publish as many case studies as possible so we can spread the word.
Yeah, that's an incredible one that
I
it
know.
helped him heal his Achilles injury by just calming
Just
down.
calming the system, right? Because it calmed
Unreal.
then the inflammation, and then the body was able to get ahead of it. Yeah.
Yeah, that's really exciting. We had some early pilot data in that domain of physical recovery from one of our early pilot trials at university, but we never had time to follow up on it. There's so many leads to follow up on, so it's really interesting to hear that that's coming back, and in what you're seeing too. And I know we have to wrap. I just want to be extra respectful of your time. I think we got
Mhm.
through almost all the questions. All the ones that we didn't answer, we will make sure to send you, and then
Thank you. Yes.
we can answer them over time. I think anybody who wants to reach you should find you at Dr. Alex Milspaw on Instagram. Is that
Yes.
that's place?
Yes. That's right.
And check out Dr. Alex Milspaw's book, Hello Down There. It's a wonderful book. I highly recommend it, especially if you're interested in any of the things we're talking about here today. And you can reach out to me at Dr. David Raven on Twitter or on Instagram. And we also have a very special Valentine's Day promotion going on right now in honor of celebrating intimacy, like what we were talking about earlier today. This couldn't be more important to celebrate and to welcome intimacy into our lives in any way we can, because this is such a critical way for us to feel healthier, to feel happier, to literally invite more joy and more calm and more recovery and relaxation into our lives. So to help do that, we're having a special Valentine's Day sale on our website from now until Valentine's Day, February 14th. So that's $50 off one Apollo or $200 off two for you and your partner. No promo code needed. And we hope that you have a vibey Valentine's Day.
Yes, I love that. That's wonderful.
Good vibes for Valentine's Day.
Yes, good vibes all around.
Well, thank you, Dr. Alex. It was such a pleasure as always. You made my month. And look forward to chatting again soon. Thank you, everyone, for joining us.
Too. Thank you, everyone, for joining.
Take care. Bye.